You should get tested if you've had even one event where hepatitis C could have been passed, whether the event was a long time ago or recently. For example, you should get tested if you have ever reused or shared any type of drug equipment, or if you have ever had a medical procedure in a country that does not properly sterilize medical equipment, or if you've had a blood transfusion in Canada before 1992, before blood was screened for hepatitis C. These are just some examples of risk events. If you're not sure if you should get tested for hepatitis C, talk to a healthcare provider. Getting your blood tested is the only way to know for sure if you have or do not have hepatitis C. How do I get tested to see if I have hepatitis C? You can go to any healthcare provider, like a nurse or a doctor, to ask about how and where to get tested for hepatitis C. Two types of blood tests are often done to find out if a person has hepatitis C. These tests are usually taken at different times. The first test you will get is the hepatitis C antibody test. This test shows if you have ever been infected with hepatitis C. It does not tell if you are still infected. If the first test, the antibody test, is negative, it means that hepatitis C antibodies were not found and you have never been infected with hepatitis C. You do not need to get the second blood test. If the antibody test is positive, hepatitis C antibodies were found, and you have been infected with hepatitis C at some time. This test does not tell if you are still infected, so you will need the second test. The next test is the hepatitis C virus test, also known as hepatitis C RNA or PCR. This second test checks to see if you are still infected with hepatitis C. If the hepatitis C virus test is negative, the hepatitis C virus was not found, so you are no longer infected with hepatitis C. But since it is possible to catch hepatitis C more than once, you may want to talk to a healthcare provider about how to prevent getting hepatitis C again. If the hepatitis C virus test is positive, the hepatitis C virus was found. This means you have hepatitis C. Your test result must be sent to your local public health department so they can count how many people have hepatitis C. However, your hepatitis C diagnosis is kept confidential. You are not required to tell anyone that you have hepatitis C. You can choose who to tell.